Tonight at 360 exclusive, the most disturbing example yet in our ongoing investigation of U.S. military veterans dying while they wait for medical care at VA hospitals. As a result of our previous reporting, Congress launched an investigation. Now we've uncovered just how far one VA hospital went to hide its outrageously long wait times. 40 veterans died while waiting for care at this hospital. Now, that would be shocking enough. Keeping them honest, though, there is more. A doctor who's left the hospital says that managers were actually keeping two waiting lists, a sham list that made the hospital look like a model of efficiency and a secret list that showed the deadly reality. Here's senior investigative correspondent Drew Griffin.
It was a plan by top management at this veterans hospital in Phoenix, Arizona to hide as many as 1,600 veterans, waiting many months just to get a doctor's appointment. CNN has learned at least 40 veterans left waiting for care. Many who are on that secret list are now dead. And what's worse, according to multiple sources, the management's plan included shredding the evidence to hide the fact there was a waiting list at all.
We've heard as many as 40 veterans here in Arizona, in the Phoenix area, could have died waiting for care.
That's correct. The number's actually higher.
Dr. Sam Foote just retired after spending 24 years with the VA health system here in Arizona. The veteran doctor says the hospital did have a list that showed the VA was providing timely appointments within 14 days. But that was a sham.
The only record that you have ever been there requesting care was on that secret list. And they wouldn't take you off that secret list until you had an appointment time that was less than 14 days, so it would give the appearance that they were improving greatly the waiting times, when in reality it had been 6, 9, in some cases 21 months.
In the case of a 71-year-old U.S. Navy veteran named Thomas Breen, the wait ended much sooner.
He started bleeding in his urine, so I was like, listen, we got to get you to the doctor, we got to get you to the doctor.
Teddy Barnes Breen says his Brooklyn-raised father, Thomas, so proud of his military service, would go nowhere but the VA for treatment. And on September 28th, with blood in his urine and a history of cancer, Teddy and his wife rushed him to the Phoenix VA emergency room, where he was examined and sent home to wait.
All they wrote on his chart was must have primary doctor in 1 week. Urgent. And they sent him home.
This is a copy of Mr. Barnes' VA medical chart stating clearly on the top urgency, that he should be seen by a primary care physician or urologist within a week.
Did anybody call?
Nope.
No.
You called?
Me and Pop called.
Numerous times.
Numerous times.
And you never got an appointment?
No, I got a response. Would you like to hear the response? Well, you know, we have other patients that are critical as well. It's a 7-month waiting list, and you're going to have patience. Lawyers
Sally
in
kept
Arizona,
calling day after day from late September through October through November. Then she no longer had a reason to call. Thomas Breen died on November 30th, 2013. The bleeding was from inoperable stage 4 bladder cancer.
They called me December 6th. He's dead already. With the
They called you and said?
I said, what is this regarding? She goes, we have a primary for him. I said, really? You're a little too late, sweetheart.
Dr. Foote says Mr. Breen's a perfect example of a veteran who needed an urgent appointment with a primary care doctor and who was instead put on the secret waiting list where he remained hidden.
And if you die waiting for your appointment, you didn't exist.
Correct. They can just remove you from that list, and there's no record that you ever came to the VA and presented for care.
Pretty convenient.
Pretty sad.
CNN has obtained emails showing top management, including Phoenix VA Director Sharon Hellman, knew about the actual wait times, knew about the off-the-books list, and defended its use to her staff, which makes this statement to CNN from Hellman all the more strange. It is disheartening to hear allegations about veterans' care being compromised, the director writes, and we are open to any collaborative discussion that assists in our goal to continually improve patient care. Sam Foote says that response is stunning.
This was all planned, and it was planned by the very highest authorities here in Phoenix.
Correct. This was a plan that involved the PINTAD, which includes the director, the associate director, the assistant director, the chief of nursing, along with the medical chief of staff, in collaboration with the chief of HAS.
Basically, you have medical directors cooking the books.
Correct.
The Phoenix VA's off-the-books waiting list has now gotten attention of the House Veterans Affairs Committee in Washington, whose chairman, Congressman Jeff Miller, has been investigating delays in care at veterans hospitals across the country. In a hearing earlier this month, he learned even the Undersecretary of Health for the VA wasn't being told the truth about the secret list.
Were you made aware of these unofficial lists in any part of your look back?
Mr. Chairman, I was not.
Congress has now ordered all records in Phoenix, secret or not, be preserved. That would include the record of a 71-year-old Navy veteran named Thomas Breen.
This is unbelievable, Drew. Incredible reporting. This waiting list for care, secret or not, must still exist, which means vets must still be waiting just to see a doctor. What's the VA doing about it, if anything?
Anderson, late this afternoon, the Phoenix VA sent us yet another statement. This one saying they acknowledge they've been having trouble, but they are improving wait times. We have no way of telling if that's true or not, and the VA in Phoenix will simply not answer any of our questions about what we're reporting, secret lists and the allegations of trying to hide the fact that veterans are now, right now, sitting on that list.
The idea that there's a secret list, I mean, it's insane. No one is held accountable, and VA, the VA itself doesn't seem to really have an answer for any of this.
This is now the third story we've reported about veterans dying while they wait for care at VA hospitals on your show, Anderson. It's happened in Georgia, South Carolina, Texas, Florida. Now Phoenix, where the management tried to hide the true waiting list, and still we get no answers from the Veterans Administration. As far as we can tell, absolutely no one is being held accountable for this. And one more thing. But for this committee in Congress, one committee, all these politicians who campaign on taking care of veterans, including congressmen, senators, and in the White House, they don't seem to be paying much attention.
It's incredible. As you said, this is our third report on this issue. The idea that the VA isn't talking to us is, I mean, it's just incredible to me. We'll keep at it. Drew Griffin, great reporting, as I said. Thank you. Up next, we're